Hey, what's up, Mama?
It burns.
What are skin burns? Okay, so skin burns are when you're kind of like a couple days ago when your brother spilled that hot coffee on you and your skin got burned. What happened to it? What did it look like afterwards?
It's like purple
Purple, and then but what happened to it? What did it look like? What formed?
blister.
A blister, right? So skin burns are classified as three categories, and you got to remember that the skin has three different sections to it. You have the epidermis, you have the dermis, and the subcutaneous tissue. And so when you get just a regular sunburn, like I had a few weeks ago when I was all red and stuff like that, that's a superficial burn, and it only affects the epidermis. But when the burn affects the lower layer, like the dermis, that's called a partial thickness burn. That's what you had. It includes blisters. Keep in mind that partial thickness burns have two subcategories. They have a superficial partial thickness, which means only the top layer of the dermis is also affected, or you have deep partial thickness burns, which means the entire spectrum of the dermis has been affected. That's a deep partial thickness burn. And then you have your subcutaneous tissue when it's affected. That's called a full thickness burns. And what's important for nursing students to know is that whenever you have a partial thickness burn or a full thickness burn, it also affects the vascular system. You're getting rid of some fluid. So when your body surface area gets burned at 20% BSA of 20% or more, when that gets burned, then you have a real significant issue with potentially developing hypovolemic shock and a couple of other things like hyperkalemia, because as the cells get destroyed, they end up releasing a lot of the potassium into the bloodstream. And so your potassium may go up, which cause cardiac arrhythmias and things of that nature, Mama. But in essence, those are burns. But I have a question for you, Mama. How did it feel when you had that burn? Does it still hurt right now? Can we look at it real quick? Let me see. Show it to you. Oh, there it is. There it is. All right, Mama. Thank you, Mama.